Good afternoon, Elliot Hanfield. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
You can now start your OET roleplay.
Good morning, I'm Elliot Hamfield, one of the nurses here. How can I help you today?
Good morning, nurse. I'm really scared. Yesterday, my son Sam had what I think was a seizure. He was shaking and his eyes rolled back. It felt like it lasted forever, and I just didn't know what to do. I've never seen him like that before. I can see that you're feeling worried, and it's completely understandable. Looking after little Sam when something concerning like this happens can be very stressful. How is he doing right now?
That sounds very frightening. I'm really sorry that you and Sam had to go through that. Well, how may I address you?
My name is Mihiraa.
Mihiraa, let's talk through what happened, so we can figure out the next steps together. Could you tell me more about what happened during the episode?
Sure, he started shaking all over, and his body was stiff. I'd say it lasted for about 2 or 3 minutes, but it felt so much longer. His eyes rolled back, and he wasn't responding to me at all. I tried to call his name, but he didn't move or even look at me. It was terrifying.
I can't imagine how scary that must have been for you. It sounds like Sam experienced a seizure. Did you notice anything else, like if he lost consciousness or seemed confused afterward?
Yes, after it ended, he was really out of it, like he didn't know where he was. He was tired and wanted to sleep right after. He's never had anything like this before. I don't know what to do.
Thank you for sharing all of that with me. It's good to hear that this is the first time Sam's had an episode like this. Just to gather some more details, could you share about Sam's medical history, please?
Yes, he had a cold a week ago, but it seemed to get better. No fever though, and he hasn't been on any medications other than his usual vitamins.
Okay, that's helpful to know, Mihiraa. Just to check, is there any history of seizures or epilepsy in your family?
No, there's no history of anything like that. That's why this has me so worried. I don't want this to mean something worse, like epilepsy.
I understand your concern. Seizures can be really alarming, but I want to reassure you that seizures in children are not uncommon, and they happen for many different reasons. Most of the time, a single seizure doesn't necessarily mean epilepsy or a long-term issue. It could be related to a variety of causes, such as dehydration, a head injury, or sometimes neurological conditions. Mihiraa, it's really important to remember that one episode doesn't guarantee something long-lasting like epilepsy. Are there any other specific questions or concerns you have at this point?
I just don't know what to do if it happens again. Should I call an ambulance? I was panicking and didn't know how to help him.
It's completely normal to feel that way, Mihiraa, and I want to give you some steps you can take if Sam has another seizure. First, try to stay as calm as possible, and make sure Sam is in a safe place, like on the floor, away from anything that could hurt him, sharp objects or hard furniture, for example. Gently turn him onto his side, so he doesn't choke on saliva. It's really important not to put anything in his mouth, even though it might feel like that's the right thing to do. Just focus on keeping him safe and comfortable until the seizure passes. When the episode ends, try to note down how long it lasted and any other details you notice, like how he was moving or if he lost consciousness. This information will be really helpful for the doctor. At home, it might be a good idea to childproof the space a little more, just to minimize the risk of another seizure happens. For example, you could pad any sharp corners on furniture or clear out any dangerous objects from areas where Sam spends time.
That makes sense. I'll definitely do that, but what about the next steps? What should we do from here?
Mihiraa, the next step is to make sure we fully understand what's causing this. Sam's doctor will likely recommend further investigations, such as an EEG, which checks for any unusual brain activity, or possibly some blood tests to rule out any underlying conditions. Monitoring Sam over the next few weeks will also be important, and I'm sure the doctor will want to keep a close eye on him. I can help you set up an appointment for Sam to see the doctor soon. Are you open to going ahead with these next steps?
Yes, absolutely. I just want to make sure he's okay.
That's exactly what we'll focus on. You're doing the right thing by bringing him in, and we'll take it one step at a time to make sure Sam gets the care he needs. I'll go ahead and arrange that appointment for you now.
Thank you so much. I feel a little better knowing what to do.
I'm glad I could help.